There is still no cure for neurodegenerative diseases. However, there are pharmaceutical treatments that can alleviate the symptoms. Much like neurodegenerative diseases, congenital lactic acidosis does not have a cure. Therefore, treatment is directed toward the specific symptoms. Ketogenic diets that are high in fat and low in carbohydrates have shown to be beneficial. Dichloroacetate has been investigated as a potential therapy for patients to reduce their lactic acid levels. However, the drug may worsen or cause peripheral nerve damage. Anticonvulsants and genetic counseling are also suggested forms of therapy.
Neurodegeneration is the progressive loss of structure or function of neurons, including death of neurons. This in turn can lead to emotional, cognitive, and even social problems among patients. Thus, people can have ranges of problems from mood swings to forgetting simple aspects of their lives. Symptoms of lactic acidosis in humans include all those of typical metabolic acidosis. For example, nausea, vomiting, generalized muscle weakness, and rapid breathing.
Alpha-Ketoglutarate Dehydrogenase deficiency is linked to many diseases, including neurodegenerative diseases and lactic acidosis. Reduction in brain metabolism as a result of alpha-KGDH deficiency have been shown to cause Alzheimer's disease and dementia. Low molar ratios of plasma ketone bodies indicate errors in this step of the TCA cycle, resulting in lactic acidosis.
First, alpha-ketoglutarate dehydrogenase decarboxylates the alpha-ketoglutarate and transfers the remaining 4-carbon aldehyde group to TPP so it forms hydroxyethyl TPP. Next, lipoic acid binds to dihydrolipoyl trinsubstanolase to form a lipoamide. The lipoamide then takes the activated aldehyde from TPP and reduces the disulfide bond and forms an acetyl group bound to the other sulfur. Subsequently, the acetyl group is passed on to coenzyme A, forming succinyl-CoA and a fully reduced lipoamide. Lastly, dihydrolipoyl dehydrogenase oxidizes the fully reduced lipoamide, allowing the FAD to be reduced to FADH2. The FADH2 is then oxidized so NAD+ can form NADH.
Alpha-ketoglutarate dehydrogenase is a rare autosomal recessive disorder, most often presenting with severe encephalopathy and hyperlactatemia with neonatal onset. KGDH deficiencies usually have a severe outcome leading to death in early infancy, and no efficient therapy is available so far. Diagnosis of KGDH deficiencies ultimately relies on enzymatic assay and, when possible, on the identification of the disease-causing gene mutation. Of the 3 subunits, only 11 E3 mutations have been reported so far.